What's up, YouTube? This is my study sheet for infection control. Define non-scomial infections, or HAIs. Non-scomial infections, or HAIs, are hospital-acquired infections within the first 72 hours. Define non-scomial infections, or HAIs. Hospital-acquired infections within the first 72 hours. Identify incidences in the U.S. 1.7 million acquire hospital-associated infections a year. Identify incidences in the U.S. 1.7 million acquire hospital infections a year. Mortality for non-scomial or hospital-associated infections is 99,000 deaths a year. Mortality for HAIs, or non-scomial infections, is 99,000 deaths a year. Percent admitted to the hospitals: 5% of patients admitted to the hospitals develop HAI or non-scomial infections. Percent pneumonia: 15% pneumonia get of that of pneumonia of that 5% are admitted to the hospital. VAPS, ventilator associated pneumonia. VAPS percent: 25% develop ventilator associated pneumonia. VAPS, 25% develop ventilator-associated pneumonia. VAPS mortality: 30% of that 25% die. VAPS mortality: 30% of that 25% die. Identify goals of infection control: eliminate sources of infectious agents, create barriers to their transmission, and monitor and evaluate effectiveness of control. Identify goals for infection control: eliminate the source of infectious agents, create barriers to their transmission, monitor and evaluate effectiveness of control. Identify 3 elements needed for infection to spread: source of pathogens, susceptible host, route of transmission. Identify 3 elements needed for infection to spread: source of pathogens, susceptible host, route of transmission. Define autogenous infection by oneself, opportunistic. Define autogenous infection by oneself, opportunistic. Define colonization: infectious agent is present. Define colonization: infectious agent is present. Understand the difference between resistance and symptomatic. Resistance: living on you or in you and no cellular damage. Not infected, colonization mode. Symptomatic: you have cellular damage and you become symptomatic. Identify risk factors for non-scomial infections: comorbidities, immunocompromised host, immunosuppression. Identify risk factors for non-scomial infection: comorbidities, immunocompromised host, and immunosuppression. Identify common transmission routes: contact, droplet, airborne, common vehicle, vector-borne. Identify common transmission routes: contact, droplet, airborne, common vehicle, and vector-borne. Contact. Most common: direct body-to-body, indirect contact with contaminated object. Contact is the most common: direct body-to-body, indirect contact with contaminated object. Nebulizers. Or what to blame for? Contact. Contact. That's what contact is. Next is droplet. Coughing, sneezing, talking. Droplet is coughing, sneezing, talking. Airborne. Droplet, nuclei or dust particles suspended in the air travel longer distances, special air filtering to contain TB, varicella, measles, smallpox, COVID, airborne. Droplet nuclei or dust particles suspended in the air travel longer distances, special air filtering to contain TB, varicella, measles, smallpox, and COVID. Common vehicle, contaminated food or water exposed to hosts, salmonella, hep A, shigellosis, and cholera. Common vehicle, contaminated food or water exposed to hosts, salmonella, hep A, shigellosis, and cholera. Vector-borne, animal transfers infectious agents from one host to another, malaria, West Nile, Rixetta, bubonic plague. Vector-borne, animal transfers infectious agents from one host to another, malaria, West Nile, Rixetta, and bubonic plague. Identify common ways that infectious organisms travel to the lungs. Aspiration, inhalation, migrate via blood from distal area. Identify common ways infectious organisms travel to the lungs. Aspiration, inhalation, migrate via blood from distal area. Equipment infection risk categories. Invasive, directly dwelling in your body. RT equipment, nebulizers, necessitation bag, bronchoscope, ventilator circuit. Equipment infection risk. Invasive, directly dwelling in your body. Respiratory therapy equipment with infection risk is nebulizers, necessitation bag, bronchoscope, and ventilator circuit. Identify infection control strategies and common examples. Decrease host susceptibility, immunization. Decrease host susceptibility, immunization. Eliminate source of pathogens, cleaning, sterilization. Eliminate source of pathogens, cleaning, and sterilization. Interrupt routes of transmission by barriers, gowns, goggles, glasses, gloves, masks. Interrupt transmission by barriers, gowns, gloves, goggles, masks. Define cleaning and describe its mode of action involving pathogens. Decreases surface tension to wash off organic material, body fluid, with soapy water. Define cleaning, describe its mode of action involving pathogens. Decrease surface tension to wash off organic material with soapy water. Define disinfection, destroying vegetative form of pathogenic organisms but cannot kill bacterial spores. Define disinfection, destroying vegetative form of pathogenic organisms but cannot kill bacterial spores. Low, inactivation of most bacteria and some viruses without elimination of resistant microorganisms or spores. Intermediate, all bacteria, most viruses, most fungi without elimination of resistant microorganisms or spores. High, all microorganisms except spores. Define sterilization, complete sterilization of microbiology life, including spores. Incineration, dry heat, boiling, autoclave, ionization, radiation. Ethylene oxide. Define sterilization, complete sterilization of microbiology life, microbial life, including spores. Define sterilization, complete sterilization of microbial life, including spores. Define pasteurization and mode of action involving pathogens. Water bath, 70 degrees Celsius for 30 minutes. Coagulates cell proteins. Define pasteurization and mode of action involving pathogens. Water, 70 Water bath, 70 degrees Celsius for 30 minutes. Coagulate cell proteins. Chemical disinfection. Acetic acid, low. 1 part vinegar, 2 parts water. Acetic acid, low. 1 part vinegar, 2 parts water. Alcohols, intermediate. Iodophores, intermediate. Iodophores, intermediate. Identify glutaraldehyde and its mode of action. Glutaraldehyde. What level of disinfectant and sterilization? Glutaraldehyde has a high level of sterilization. Glutaraldehyde disinfects in 10 minutes. Glutaraldehyde disinfects in 10 minutes. Glutaraldehyde disinfects in 10 minutes. And glutaraldehyde has a high level of sterilization. How long does glutaraldehyde take to sterilize? 3 hours. How long does glutaraldehyde take to sterilize? 3 hours. What percent? Above 1%. Glutaraldehyde is good when it's above 1%. Glutaraldehyde is good when it's above 1%. Adverse effects. Vapors are toxic, cause film, need PPE, harm skin. Glutaraldehyde. Adverse effects. Vapors are toxic, cause film, need PPE, harm skin. OSHA recommendation for glutaraldehyde, below 0.2 parts per million. OSHA recommendation for glutaraldehyde, below 0.2 parts per million. How long is glutaraldehyde good for? 28 days unless it's below 1%. How long is glutaraldehyde good for? 28 days or unless it's below 1%. Of the following, identify mode of action involving sterilization as well advantages and disadvantages. Autoclave, pressure steam, 15 psi at 121 Celsius for 15 minutes. Autoclave, pressurized steam, 15 psi at 121 Celsius for 15 minutes. ETO, ethylene oxide, colorless toxic gas activated at room temperature. ETO, ethylene oxide, ETO, colorless toxic gas activated at room temperature. Toxic. ETO is toxic, so watch out for that. Hydrogen peroxide gas. Plasma safer than ETO. Takes 1 hour. Parasitic acid used for bronchoscopes and endoscopes. 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 Identify common equipment and technique indication used for barrier precautions. Hand washing. Regular 65% alcohol-based to sanitize hands. Hand washing. Regular 65% alcohol-based to sanitize hands. Gloves for contact. Mask. Splashes, sprays, bodily fluid. Mask. Splashes, sprays, bodily fluid. N95, COVID and TB. N95, COVID and TB. Goggles, face shields, splatter. Goggles, face shields are used for splatter. Gowns, aprons, shoe covers are used for splashes. Gowns, aprons, shoe covers are used for splashes. Gowns, aprons, and shoe covers are used for splashes. Define standard precautions. Employ PPE as indicated with likelihood of being exposed. Define standard precautions. Employ PPE as indicated with likelihood of being exposed. Transmission-based precautions. Airborne precautions, mask, gown, glove. Airborne precautions, mask, gown, glove. Droplet precautions, mask, gown, gloves, goggles. Droplet precautions, mask, gown, glove, goggles. Contact precautions, gowns, gloves. Contact precautions, gowns, gloves. Reverse isolation, everything. Mask, gowns, gloves, goggles. Reverse isolation, everything. Mask, gowns, gloves, goggles. Ventilator circuit, clinical practices guideline. Bacteria filters are put in line. Ventilator circuit, clinical practice guideline. Bacteria filters are put in line. VAP guideline. Elevate head, sedation, vacation, peptic ulcer, prophylaxis, oral care with chlorhexidine. VAP guidelines. Elevate head, vacation, sedation, peptic ulcer, prophylaxis, and oral care with chlorhexidine. VAP guidelines. Elevate head, sedation, vacation, peptic ulcer, prophylaxis, and oral care with chlorhexidine. VAP guidelines. Elevate head, sedation, vacation, peptic ulcer, prophylaxis, and oral care with chlorhexidine. Handling of contaminated articles and equipment. Impervious bags double bagged and incinerated. Handling of contaminated articles and equipment. Impervious bags double bagged and incinerated. Handling of needles and sharps, sharps container. Handling of needles and sharps, put in sharps container. Common respiratory therapy equipment that are problematic with infection control. Nebulizers, vent circuits, resuscitation bags, suctioning systems, and bronchoscopes. Common respiratory therapy equipment that are problematic with infection control. Nebulizers, vent circuits, resuscitation bags, suctioning system, and bronchoscopes. Common respiratory therapy equipment that are problematic with infection control. Nebulizers, vent circuits, resuscitation bags, suctioning systems, and bronchoscopes. Define surveillance program, CQI, continued quality assurance. Ensure infection control, routine sampling, and microbiological identification. Define surveillance program, CQI, ensures infection control, does routine sampling and microbiological identification. Define surveillance program, CQI, continual quality assurance, ensure infection control, or CQI ensures infection control in the surveillance program. CQI also does routine sampling and microbiological identification. That's it. Hope y'all enjoyed. That helps you a ton. Catch you on the next video.